Can you guys hear me okay? Can somebody give me a thumbs up? Natalie, great. Thank you. We are at the 2 o'clock hour, and it looks like we have a lot of folks still joining us right now. I know there's a lot of people. We had over 300 folks registered, so I'm going to let our other co-hosts continue to admit people into the room. If you guys have any issues hearing, just let me know. Natalie, is the sound coming through okay, even though folks are coming through? Okay, great. So we will go ahead. Okay, we can hear you good. Great. So let's go ahead and get started since we have a really packed agenda. And I'm going to do a brief welcome and introduction this afternoon. Turn it over to Becky Hoffman for a little bit on logistics for those of you that may have not used the Google Meet platform before. But I do just want to start out, if you are not presenting, please mute yourself. There's a little button in the bottom for your microphone. Just mute your line so we don't hear background noise as well. So I am Maggie Baldwin. I'm the state veterinarian in Colorado, and I am housed in the Colorado Department of Agriculture. I'm really happy to be here this afternoon. There's a lot of colleagues that have put a lot of work into making this workshop hopefully run smoothly. Hopefully it will have a successful workshop today and on Thursday. So as a reminder, this is a two-part workshop, and we're hoping to get a lot of stuff packed into today and on Thursday. And let me make sure my slides advance. There we go. So when we talk about rabies to different groups of people, we get a lot of different perspectives on, the disease, on management of rabies cases, and oftentimes that can vary depending on your line of work. It can vary depending on your geographic region, even within our state in Colorado, and also past experiences with cases and case management. So we all know that rabies is a risk here in Colorado. It's present in our wildlife, and that poses a risk for spillover into other wildlife, into our domestic animals and domestic species, as well as humans. And everyone here in this workshop today plays a really important and critical role in mitigating that risk to protect both animal and human health. Whether that's through management of confirmed positive rabies cases, suspect cases, or edible bites. Sorry, we're getting a lot of beeps coming through right at one time. Or exposure assessments. So the facets of rabies cases can be really complex, and really appreciate everybody being on today. I think that management can vary depending on the species involved, depending on the geographic region you're in across Colorado. And also with local authorities and resources, the capabilities for response can vary. So we really wanted to bring everybody together for this virtual workshop this week to walk through rabies response and the important role that everybody here plays. And we want to make sure that you guys all have the knowledge and tools at your disposal for local response efforts, and to ensure that you know what state resources are available for you as well. So I do see we've got a couple of folks off mute. Just as a reminder, if you could please mute your lines, because I am hearing some background noise. And then we'll get started. We'll jump into our agendas. And I think, Becky, I think if you guys could monitor the lines, I think we have the ability to mute folks as well. If you're not sure how to mute, we can find that for you as well. So today, day one of the workshop, we've got a lot to go into today. And we did get some questions ahead of time on the question form. Thanks to the folks that have used that question form. First, we're going to talk about the basics in biology, just make sure everybody has the same understanding of rabies and what rabies is, what species are impacted. And Dr. Marzek is going to go into, specifically what we see here in Colorado. And then the three agencies that started putting this workshop together, we're going to talk specifically about our role as regulatory agencies. So the Department of Public Health and Environment, me at Colorado Department of Agriculture. We'll have Parks and Wildlife talk as well. We'll go into a little bit on after hours and introduction into labs and diagnostics. We do have some folks here from our diagnostic labs, really looking forward to hearing from them, and best practices for rabies case submissions. And at the very end, we will drop a link into the chat box that you guys can fill out to get a certificate of attendance. So we'll do that in the last 15 to 20 minutes to give you a little bit of time. I know a lot of you probably do have the ability to get continuing education for some of these, depending on your roles that you're in. So you will get an emailed certificate of attendance if you fill that link out at the very, very end. And then on day 2, just a preview of day 2, we'll have a brief recap of what we're going to talk about today on day 1. And we'll have our CDPHE folks talk about animal bites. We did get a lot of questions on animal bites in the pre-submitted questions. I think there's a lot of interest around that. And then we'll go into case investigations. What does a normal case, routine case investigation look like? And then we have some case presentations, and we'll have folks from our public health side, as well as CDA and one of our USDA folks that's going to be doing some case presentations. We'll also have a certificate of attendance at the end of day 2. We are recording these, so just so you know, these will be recorded. We're hoping to make these recordings available to anybody that has registered. So if you're only able to attend one part of the workshop and say you can't attend Thursday, we'll make that recording available for you as well. So those are the agenda items, and with that, I am going to turn it over to Becky Hoffman, who is going to give us a logistics on Google Meet and using this platform for the workshop today and Thursday.
Thank you, Dr. Baldwin. So first of all, I have to say this is the largest webinar that I have ever played kind of the logistics role in. So hopefully we don't have too many glitches. So far, everything seems to be working fairly smoothly. One of the things that I would like to mention is closed caption. I have it turned on in the meeting settings, but I'm not quite sure if that comes through on your side. If you don't see it and you would like to utilize it, you will find it in your bottom toolbar next to your mic and your camera. It just says CC. The other thing that we will be using is the all right, great. Thank you, everybody, for the feedback. That's good to know. We will be using poll questions, and I'm sure some of you have been on Zoom calls in the past that use poll questions. These work a little bit differently in that they don't pop up in the middle of the screen like they do on Zoom. I'm going to go ahead and launch our first poll question just so that you can see what it's like, and if you would just answer it, and as I get most everybody answered, I'll show the results just so everybody has an idea of what we're looking at here. All right, everybody should see a notification for that poll question on the side of your screen, and you have to click in that icon to answer the poll. As you can see, there is the chat available. Some of you have been using that. And I just saw someone else raise their hand. Both of those will work for questions. We have got a couple of our staff members. Fortunately, I had some volunteers step up to help me so I can try to make sure everything keeps running smoothly. If you have questions, either use the raise your hand feature or the chat feature. Anything else you can think of, Dr. Baldwin?
No, I think that's it on logistics.
All right, sounds good.
We have just a few reminders. Becky just went over the logistics on how to use those tools. But please, as I mentioned at the beginning, with such a large audience, please keep yourself on mute. And I think if we hear some background noise, we can hopefully find the folks that have accidentally come off mute and mute those so we have minimal disruptions. As Becky mentioned, the Q&A feature to ask any questions. And the neat thing about that is that those will be recorded so we can come back to those at a later time as well. The chat, it gets a little bit lost in there. So if you have a question specifically, use the Q&A feature. and raise your hand to ask a question verbally. We'll hopefully have a little bit of time for verbal questions between presentations, but we're pretty jam-packed today. On Thursday, we'll have maybe a little bit more time for discussion as well. And then just for, I guess, bandwidth issues, if you want to keep your video off unless you're speaking, that might help with some folks' bandwidth, or unless you're a co-host as well, that's appropriate. But that might help with some bandwidth issues that some folks might have. And just a big thank you to everybody that is on the workshop today. We are really excited about this. We actually, this was a brainstorming session that we had over lunch with our CDPHE folks one day. It was the first time we had seen each other in person in a couple of years. And we were having lunch and we said, I think it'd be a great idea. We've kind of been in COVID for the last couple of years, and there are other diseases that we're still dealing with. And rabies being one of the bigger ones that I think we all play a really critical role. So really appreciate all of the interest and appreciate everybody being here today and on Thursday and having, an interest in this. So with that, I am going to stop sharing my screen and turn it over to our first presenter, who is Dr. Marzak with CDPHE. Natalie, are you on?
I am. Sorry, I was working on sharing my screen, and I think it just worked.
Yep, looks good.
Awesome. Okay. Make sure my controls are working. All right. My name is Natalie Marzak. I think most of the public health folks will know me. I'm the Zoonotic Disease Unit Manager and the Rabies SME at the state, subject matter expert. And I'm going to give you, hopefully, a good overview of rabies biology and epidemiology, particularly in Colorado, over the next 20 minutes. And now my controls are not working. There we go. So I'll go very briefly into biology, only because it's interesting, and then we'll get into the good stuff like transmission, the animal reservoirs, some veterinary epidemiology, both for our state, our country, and then internationally, and then a little bit of human epidemiology in the United States. So I like fun facts. So I was wondering where the term rabies or the name rabies came from. And of course it is Latin for madness, from the Latin verb to rage. But they do think that it originated, that Latin version came from the Sanskrit of rabas, which is to do violence. And if you know that rabies is part of the Lissa virus family, Lissa is Greek for violence. Okay, so a little bit of biology and pathogenesis. So rabies viruses are part of the Lyssavirus genus. Sorry, I said family and I should have said genus before. The family is Rhabdoviridae, and they are known for their classic bullet shape, which rabies does have. It's a non-segmented negative-stranded RNA virus, for those of you who keep track of such things. And I pulled these two images from CDC's Public Health Image Library to give you an idea of what it looks like. Transmission usually involves a bite. So you have, in this diagram, there's a poor domestic dog here who's been bitten by a raccoon. And this, of course, is one snap. These would be subsequent events, not necessarily everything happening at the same time, as we'll go over in a minute. But you can see that the raccoon has bitten the dog. The virus replicates in the muscles and then moves up the motor nerves, replicates in the spinal cord, and then moves up the spinal cord into the brain, where it then moves into the salivary glands and is exuded, I guess, into the saliva, and the saliva is infectious. So the important point here is that until the virus gets to the brain, there is no chance of this dog being able to transmit rabies because it's not in their saliva yet. So it has to make its way all the way up the nerves into the brain and then into the salivary glands. So what would this look like? What would this actually, what story would you get? So let's say you have your dog there. The dog is bitten in the hindquarters by a skunk, and the skunk has rabies. So the virus incubates in the dog. At this point, the dog is asymptomatic. The dog is not infectious. And the length of the incubation period is variable. It's partly dependent on the distance from the brain that the bite occurred. So because the virus has to kind of crawl up the nerves to get to the brain, the further the virus is from the brain when it enters, the longer it will take to get to the brain and become encephalitis and transmissible. So if you're bitten on the foot, you have longer than if you're bitten in the face. So once the virus has gotten to the brain, symptoms will start within days. And then the virus will go to the salivary glands from the brain. So in theory, the dog should be symptomatic within a couple days of being infectious. We do have research that shows that dogs, cats, and ferrets are dead within 10 days of shedding the virus in their saliva. So they will be dead within 10 days of transmitting rabies via bite. And then the animal dies. So useful tidbits that you might find helpful. Rabies is not transmitted through blood, urine, or feces. It's also not transmitted airborne. The virus dies very quickly outside the host. My rule of thumb is if the saliva is dry, the rabies is dead. The virus is already in the brain when the saliva is infectious. So an animal that is shedding the virus in the saliva, it only happens about maybe at most a couple days before neurologic symptoms are apparent. Incubating animals are not infectious. And intact skin protects against rabies. So the virus has to get past the skin either via a bite or bypass the skin with contact through mucous membranes or entry into a wound. Okay, little bit of veterinary rabies epidemiology. So this is the first known mention of rabies in historical texts. This is from about 1930 BC, from the Codex Avishnuna from Mesopotamia. And this shows that they understood that if dogs had rabies, that the dog should be kept under control because if it bit a person, it would cause his death. And Wikipedia tells me that 2/3 of a mina of silver was actually a lot of money. So it was a big fine. Shoot, my mouse is very sensitive, I apologize. Okay, so I went back and looked at all of our data from 2007 to 2021. And these are where we have had positive bats. And you can see we expect to have positive bats across the state. A lot of the reason for the holes that you're seeing in this map where there aren't blue dots is because of a lack of testing probably. People aren't coming in contact with the bats aren't being tested. So we don't think that those holes are places where bat variant rabies is not present. Okay, South Central skunk variant, however, is more limited. So you will see some blue dots on the western slope. I don't know if you can see yeah, you can. Okay, so there's this guy in Mesa, there's 3 in La Plata, 1 in Archuleta. Those were all skunks that were rabid, but did not have skunk variant. They had bat variant rabies. So our endemic area for skunk variant rabies is all in the foothills to the eastern plains. And that's partly because the entrance of skunk variant rabies came from our eastern border, came through Kansas. So domestic animals, far more common to have a rabid domestic animal in a place that has skunk variant, just because of the interaction between terrestrial animals. This guy up here was a mule from this past year, and that was a bat variant case. Okay. So this map shows you what other states are dealing with as far as variants in rabies reservoir species. So the entire country, contiguous United States, has bat variant. Puerto Rico, Alaska also have bat variant. Hawaii does not. I joke with my husband that we're going to retire to Hawaii because it's rabies free. Skunk variant is the olive green, so you can see that big chunk of the middle of the country, but then also in not Canada, in California, Kentucky, and Tennessee. That blue-green all up and down the eastern seaboard, that's raccoon variant rabies. And then you can see fox and skunk in parts of Arizona and New Mexico, and a little bit in Texas, and then mongoose in Puerto Rico. So internationally, canine rabies is a much bigger deal than it is here. So you can see the light green countries, including the United States, those are canine rabies free countries. Red has endemicity of canine variant. So a dog bite in those countries is a much different risk than a dog bite in the United States. Orange being suspected, but we might not have the data.
That's enough.
Oh, sorry. Here we go. And that hash, the yellow or green, I guess, and orange, means that we don't have data. And I got this from the WHO website. I'm not sure how accurate it is. They did not have a date on this map, the date that the data is current through, but my expectation is that it's been within the last year or so. Okay, wildlife mediated rabies looks different. We do see—
Natalie, we do have a question. It goes back a little bit to your previous topic. If you handle a dead infected animal, example, you get saliva on you, can you be infected?
So as I said with the point about skin, if it's intact skin, then you should not be infected unless you then wipe your eyes and you wipe the saliva into your eyes, nose, or mouth. So the saliva can't get past the skin on its own. It would have to be introduced into a mucous membrane or through the skin, either via an open cut or a bite. Okay, of course, you're welcome. All right, so epidemiology of human rabies cases. I found this again on Wikipedia because apparently that's where I've been living. This is from the Canticles of Saint Mary of Terena, who was a Portuguese saint. This dates back to the 13th century. And this is showing 2 monks who have been infected with rabies. And there are these guys in the middle here being brought before the saint to be cured of rabies. But I thought it was interesting to see that they've been bound just like a criminal would, which I thought was very interesting. Okay, this is data from the CDC going back through 2012. These are the cases of rabies in humans that we've seen in the US and Puerto Rico they go back all the way to January of 2009, but when I tried to put all of that on the slide, it looked really ugly. So if you would like to go look for yourself, feel free. And this shows the date of onset of symptoms, the date of death. You can see people are usually dead within a month at the most. The state that they were reported out of, and that would be the state of residence, not necessarily where they were exposed, the exposure that happened, and the rabies virus variant. So primarily, the people in the United States who get rabies within the United States will get bat variant, although you do see that raccoon bite, or not bite, sorry, that raccoon variant with an unknown exposure in 2018 out of Delaware. But we do get cases of canine rabies that are obtained overseas. In a lot of these cases, people are unaware of the risk, or they are not told of the risk when they're bitten by a dog in another country. And I'm seeing another question. Okay, do spelunkers have to worry if there's a continuous drizzle of bat spit and urine in a cave? So this is a toughie because, so the urine is not concerning. Bat guano is not considered infectious for rabies. For other things, yes. The likelihood that there would be enough bat saliva dripping on a spelunker and getting into a mucous membrane or an open wound, that's It just seems very unlikely to me. I think if there was physical contact with the bat, then absolutely that would be a concern. But proximity to bats in caves, if you're not actually in contact with the bat, I think the likelihood that there would be an infection would be very low. But a gray area, because in theory it's possible, but in practice it's not very likely. And Mary, I have to refamiliarize myself with the kidney transplant case, but I can get back to you if you email me. And then Sean is asking, how long after the animal is deceased does rabies stay in the body and is still infectious? We don't know. We do expect that while the carcass is still, juicy, while the brain still has fluid in it, it's possible that the virus is still in there. But I don't know of any research that has shown definitively how long the rabies virus remains infectious within a carcass. We do recommend handling carcasses that you wear gloves, that you not disturb the brain cavity or the spinal cord if at all possible, for this reason.
And Natalie, just we should have mentioned this at the beginning. Oh, you're already on your last slide. But there's a lot of really good questions already, and we're keeping track of those, so we can send in a follow-up email if we have a specific literature, specific article that we could reference back to on some of these specific questions. But lots of good questions already.
So I was hoping I would end a little early so I could try and answer some of those questions. How should I do that?
There is one question in the Q&A. This goes back to the raccoon bite with the dog. Is there any idea how fast the virus migrates?
I knew someone was going to ask me that, and I totally had forgotten. I don't know if Maggie, do you know? Thank you.
Yeah. So one article referenced 50 to 100 millimeters per day, 50 to 100 millimeters retrograde per day.
Thank you. That's one of those numbers that just won't stick in my brain.
Excellent.
Well, my email address is here if anybody would like to correspond about rabies. And yeah, contact me if you have any questions about exposures, risk assessments, anything you need.
Great. And next up, I think we've got Dr. Jennifer House that's going to talk about CDPHE role.
Hi. Okay, so I'm sharing my slides, hopefully. Okay. So I am Jennifer House, and I am the public health veterinarian located at the Colorado Department of Public Health and Environment. So today you're going to hear from the state vet, the public health vet, and the state wildlife vet. We're all three different people, and we all represent different agencies. And we're each going to talk a little bit about the roles within our agency. So I'm just going to talk about the health department role. The first thing we have is the administrative rule. This administrative rule is in the Colorado Code of Regulations, and it's the Epidemic and Communicable Disease Control Rule that gives us the authority to receive information on infected people and then to take action on that. And part of that rule, it's Regulation 8. There's a clause in there that says that reporting of diseases among animals is required to be reported to us also. So yes, we do have state authority through administrative rule to get information on suspected animal diseases. And also in that same regulation is a clause about allowing veterinarians to issue a medical waiver in jurisdictions with rabies vaccination requirements. So some of you may be in jurisdictions where somebody, there's a dog by and you're investigating and they've got a medical waiver that says their dog doesn't have to be vaccinated against rabies. So yes, that is an administrative rule that we can allow that, but it's a medical waiver and it has to be written by a veterinarian. So this sort of leads to the question of, well, isn't rabies required everywhere? So we have a polling question coming up. So Becky, can you do the polls?
It should be there.
Okay, and are you guys able to see that as a presenter? I can't see what's going on behind the screen.
Yep, and it looks like we are getting answers. So, and it's the second question. Does your local jurisdiction have rabies vaccination requirements for dogs? Is that the one, Jennifer?
Yes, that would be the first
Great.
one. It's about dogs. And then Becky, when you feel like we're done, you can close it, and then we have a second one, a second polling question. Okay, we'll go ahead and close the polling. So I'm going to analyze those results later and give you an opportunity to give me your jurisdiction's ordinances, because we'd like to know, because this leads to lots of confusion and questions, because there is no state rule that says all dogs and cats must be vaccinated against rabies. It's very locally driven. And it is through the authority of this next statute. So we do at the health department have a second rule that is related specifically to rabies, and that's Colorado Revised Statute, Title 25, Article 4, Part 6. There's 15 subparts, and if you read them, each of them are very short. They're quick reads, but they all deal with a different aspect of the authority for rabies and rabies control in pets. And basically what this says is it's giving the authority to the local jurisdiction. So I can't specifically tell you what the rules are in your jurisdiction. We have done polls and we've asked questions, but I could get information today, and through local ordinance, it could change tomorrow. So not being at every town hall meeting in the state, I can't really tell you what's happening at that local level. But this particular statute, and I know several of you have had to use this statute, so this is the statute that gives you the authority to confine an animal if it's running loose, to confine an animal if it bites a person, to require inoculation in your county, and then to enforce either the inoculation or the bite requirements. So all of this authority is, it's you guys. You're the ones that have this authority, not us. But we can help you find these laws and regulations so that you can use them as needed. So this is we periodically, every 5 or 6 years, we get a student to call up the local counties and try and update the ordinances, and they do change. This was last updated around 2016. We hope to do it again in the near future. But this is the canine regulations throughout the state. If the county is highlighted in blue, it means that there is some type of rabies vaccine ordinance. Some counties require it along with licensing. Some counties don't have licensing, but they do require rabies vaccines. So that's what the blue is, and you can also see that it's sort of a hodgepodge. There's some counties that the county doesn't require it. For instance, the county of San Miguel may not require it, but the city of Telluride does. The red counties, we specifically have been told that they do not have a county ordinance related to rabies. So if you lived out in the county, you don't have to vaccinate your animal. But if you lived in a city, say the city of Sterling requires it, while the county of Logan does not. So if you live within city limits of Sterling, you are required to have it. Now, the counties that are not highlighted, these are ones where we could not specifically get an answer. The reality is if we could not easily find an answer, there is probably not an ordinance that requires it. But if you happen to be from one of those counties and you do know yes or no, we would like that. And at the end of my presentation, I'm going to have an email address that I would love for you to send us the specific language in your ordinances, and we will actually start trying to keep track of that. So this slide is for dogs, and then the second question about cats. Cats are not the same as dogs. There's several jurisdictions that do require canine rabies vaccines, but they don't address feline rabies vaccine. This is actually a much less attractive map, lots of red in this particular map that says the counties don't have to vaccinate the cats. Now, of course, as a rabies expert and a veterinarian, I am recommending that all cats and dogs be vaccinated against rabies. It makes things much easier. It protects the animal from getting rabies, but then it also helps us because we know what we need to do if an animal does get exposed, which happens all the time. Lots of animals get exposed to rabies. So having them pre-vaccinated against rabies before the exposure happens is really what we're trying to look for. So even though these are what the laws say, we still recommend that you get it done. And then if that wasn't complicated enough, in 2018, we sort of polled the counties to try and figure out who does what within the county. So the counties and cities all have different rabies vaccine ordinances, but then who handles it at the local level is also completely different. And that's why we asked all of you guys here today, and we asked you to check your county's ordinances and regulations before you came to the workshop, because this, from the health department status, is what we're dealing with. And this has actually changed within the past 4 years since we last did this. There's been a lot of changes in the past 2 years. But when we did this at the time, all the counties in green were being managed, animal bites and rabies response was being managed by some type of animal agency, mostly animal control, maybe a humane society or two in there, or some type of law enforcement. The darker blue color is the communicable disease program within the health department. So this is often what you would refer to as the nursing division of your health department. The yellowish counties, the light pale color, that would be in the local health department, but it's in the environmental health section of the health department. So even when it's done at the health department, it might be two completely different teams of people that are working on it. The purple counties, these are highlighted particularly because they are not individual counties. Often there's one person who's covering 5 or 6 counties, usually at the health department level, but they have way more responsibility than one county or one disease that they're working on. The orange counties, this is where our point of contact is the health director themselves. There's nobody else in the county working towards rabies or animal bites. And then the red counties are counties that specifically have no resources, and if we call them with an animal bite or rabies concern, they don't even know who to tell us to talk to. So that's why we want you guys to talk to each other now, is so that this map can be a little less confusing. And basically what we're trying to say is that animal bites and rabies are very, very messy. We know that. We're not trying to trick you. It's very dependent on what the ordinances say and how the county is set up. Little things like who fills out the bite report can vary between counties. Where the bite goes to. Does it go to animal control? Does it go to the health department? Does it go to Parks and Wildlife? So what format is the report in? Is it a paper form, an email, a phone call? Which database does it go into? There's even more than one databases. There are tons of databases that we may have to talk to. And the reality is these databases do not communicate with each other. So if we put something into Cedars, it's not going to go into Chameleon. If you put something in Shelter Buddy, it's not going to get in RedCap. So we have all these databases that are not like each other. They don't communicate with each other. And at best, it requires a lot of duplicate data entry. At worst, it gets into one database and the person who needs to follow up doesn't get the opportunity to follow up. And the reality is, so how long does this take for a report to get to the right agency for follow-up, if it gets there at all? In some cases, the average appears to be about 7 to 8 days, which at that point the animal is released from quarantine or is long gone. Or it could be that it just never gets there, so the right person may not even be able to follow up as needed. So now that I have completely confused you about all of our policies and the agency responsibilities of who does what, I want to let you know that we are here to help you. We do have a website. So go ahead and write that website down, and there will be an after workshop email that is going to give you some post workshop homework, but also websites like this one. So I'm just going to give you a snapshot of what the rabies website looks like. So there is a lot of information on rabies in here, and that's because there just is a lot of information on rabies. But what you need to know is if you go to that website that was on the previous screen, right up here at the top, we have risk assessments. And the risk assessments, these are for humans. If you have a person that is bitten by an animal, or either a wild animal or a dog or cat, you can do there's a chart that I'm going to show you in the next screen. The statutes that I mentioned, if you go right here, that's where the statutes are. And then we have a specific section for animal control and wildlife professionals. So if you go straight to that section, there's going to be forms, there's going to be guidance, lots of resources for you. And then down here we have data and statistics. So if that interests you, this is my favorite part. I like to see how much is in there. So we do recommend you go to data and statistics. So this is the first assessment. So when a person is bitten by an animal, and there's a lot of information on this slide. We do recommend, if you have not been to our rabies website and checked out these resources within the past year, you're going to be out of date. One homework assignment is for you after this workshop to go pull out that paper binder that you have, the workbook that you have, and update all the documents in there. We review the documents on our website at least once per year. And things do change. Rabies itself does not change, but we try to use the most standard, up-to-date guidance that we can. So in here, it will walk you through if a person is bitten by any species of animal, kind of what the next steps are. And then below that is, the biting animal is a dog or cat, because that is where the majority of our authority lies. And this is the majority of animal bites are from dogs, number one, and cats, number two. And then everything else is in the minority. We don't see a lot of other species actively biting people, but we do see thousands of dog and cat bites. So we do have this rabies algorithm to help you walk through what is a rabies risk and what is not a rabies risk. In general, an aggressive animal or an aggressive dog or cat is not a rabies suspect, but an assessment needs to be done just in case that animal does have rabies. So we do have that on the website. And then also on the website, we have rabies prevention and control policy. This policy was last updated in 2016 to go along with the national standards. We had a work group, and the work group was the Department of Ag, the Department of Wildlife, Department of Health, both state and local level, animal control offices, and veterinarians. So we had a large task force where we went through step by step. And the reason that there's two arms is we want two things to happen at the same time. We want to know what the species is and try to get it either quarantined and tested as necessary, and to determine the vaccination status of the animal. This is what you really need. You need this. I would recommend going to the website and printing this out. And then I annually update put it on your calendar. Like if you go and check the website today and update your documents, put it on your calendar for next February to go back again and recheck to make sure that you're using the most current documents that are available. And we do regularly get the question, what do we do if a pet dog or cat has not been vaccinated against rabies? And we have guidelines. We have 120-day quarantine, plus or minus 30 days, depending on how quickly they get vaccinated. And then a vaccine schedule. But then we have this overdue vaccination booster. So you may end up with an animal where the owner swears up and down they're vaccinated, but they don't have any documentation. We have a protocol for this too. But this protocol is very tricky to use, and it's going to require the local health department's approval to use it, and it's going to require a veterinarian to actually take the blood sample twice, vaccinate the animal. So there is a protocol, but this protocol, we used it several times at this point. So we have it down of exactly how it needs to be done. Don't try to do this yourself. Please call and ask us for assistance to administer this correctly. We have had individuals try to do this without calling, and what happens is we get a test result that cannot be interpreted. The animal ends up having to go into the 120-day quarantine. And then ultimately we've wasted the client's money. So there is protocols for that, and this is on our website. We do partnerships, like I said, will be a task force of how to follow up on pets that are exposed to rabies. All of these groups came together and we worked out a process. So we are dependent on all of you. We're dependent on the Department of Ag, Department of Parks and Wildlife, the local public health agencies, animal control and law enforcement, humane societies and shelters, and then hospitals and healthcare providers. We're dependent on you to help us make sure our documents are the most current and most practical that they can be while still protecting human health. So at this point, I'm actually going to pass the presentation over. I mentioned if you do have a rabies ordinance in your local jurisdiction, to email it. If you could email it to the cdphe_zoonoses@state.co.us, we'll start compiling those so that we have a running database so we know what ordinances are out there. And if you don't have an ordinance and you know you don't have an ordinance, we'd actually like that too, so that we can update our map. And at this point, I'm going to hand it over to the next speaker.
Real quick, there was a question if there were directions on the website for putting bites into when you're reporting.
Into Cedars.
Yeah, into Cedars.
Okay, that is a great question. Let me change my screen here. Okay, so animal bites into Cedars. If you're with the local health department, we actually do have a Cedars training that will be occurring tomorrow at 11 a.m. If you can't attend that live, it will be recorded, and we can actually email that recorded training to you, and that will give you the basics on putting information into Cedars. Did that address the question? And Natalie will also be giving a presentation on Thursday that is specific to animal bites that may go into more detail.
This is Mary. I asked that question. I guess my question is, are we supposed to put animal bites into Cedars when we get it from the animal control officer? Because I was told we're not supposed to put them in, but are we or not?
Okay, that
how do they get in there?
That is a local decision, and animal bites are available in Cedars if your agency would like to use Cedars for that. We acknowledge that Cedars is not the best repository because only the local health agencies and hospitals have access to Cedars. Cedars is restricted, so animal control offices can't use that. So if you have an animal control office that is following up on your animal bites, they're not going to be able to see that. So if you don't want to do duplicate data entry and you have another system that your animal control partners can use, that is fine. You are not required to use Cedars, but it is there if you need it. And I know we have a lot of questions in there. What we're going to do is go ahead and put your questions in the chat. Because we are short on time today, what we're going to do is we are going to grab those questions out of chat. We're going to try to do a Q&A at the end of today and the end of Thursday. And if we run out of time, what we'll do is we're going to take those questions and we're going to answer them, and we will send them in the post-workshop email. So yeah, we're not ignoring your questions, but the reality is these questions, one question could potentially lead to a 20-minute discussion, and we want to make sure that all of our topics get covered today, but we will address them at a later time by email if we don't get to them today. Okay, and at this point, I am going to hand it back over to Maggie to talk about the Department of Agriculture's rules.
Awesome. Thank you so much, Dr. House. Really appreciate it. So far, great presentations and great questions. So as a reminder, if you guys did have questions, you can put them in the Q&A function as well. That's something that will be saved afterwards. If you hit the little, let's see, triangle, square, circle icon in the bottom right corner, there's an option for Q&A there if you don't want to drop it in the chat. So I'm going to talk about rabies in Department of Agriculture and what our role and authority is in rabies control in the state. Some of you may not really know much about the Department of Agriculture, so I thought I'd give you a little bit of, an overview of what the Department of Agriculture, and then my division is the Animal Health Division, also known as the State Veterinarian's Office, what we do. So we've got a bunch of different programs in our division, of course, livestock and animal disease control being one of our primary ones. Animal disease traceability, how do we keep track of diseased animals or even healthy animals for that matter? Emergency preparedness and response is a big one that we do on both the disease side, as well as things like all hazards incidents for wildfires and floods and tornadoes. We also house the Bureau of Animal Protection, which is our animal welfare branch in the division. And some smaller programs is alternative livestock, aquaculture, and predator control. So in our division, we have, when fully staffed, when we've got our full team of people, we have 17 people in my division, and that's a number of veterinarians, and I'll show you a map next with our field folks. So we've got a number of veterinarians, some that's in the office, some that are based in the field. We have program managers to carry out the variety of different programs that you see here, and then we also have folks at our local sorry, not at a local level. We have folks that are at the office that serve as administrative support staff. Really, all of the work that goes into all these different programs is kind of touched by everybody in our division. And we also have the Division of Laboratory Services in the Department of Agriculture, and they have the Animal Health Laboratory. They do program testing and some regulatory testing, but not rabies. So that is something that we'll cover here in a little bit on diagnostic testing. So our map in Colorado for our field veterinarians, we've got 4 right now. We're supposed to have 6, and 2 of those positions with USDA are currently vacant. So right now we have 4 veterinarians that are covering the state, and this is our field veterinarians. So when there is a call that you guys need assistance for sample collection, sample submission, these are the folks that you guys are typically talking to in the field. 2 of these, as you can see, are CDA. I don't know if you guys can see my mouse. You might be able to. There we go. So 2 of them are CDA, which is Department of Agriculture. So Dr. Pete Ralph, he's our new Western Slope field veterinarian. He's with the Colorado Department of Agriculture, so he's state. And then Dr. Ken Newens in the blue, he is also CDA. He's one of our state field veterinarians. And then we have 2 USDA field veterinarians, which is the United States Department of Agriculture. And that's Dr. Richie Ann Lomkin out here on the east, and Dr. Tim Fox that covers the mountain region in the purple area there. So they're the folks in the field when you need somebody. And we have an interactive map available on our website. You'll get their cell phone and their email address. And so always available for calls and questions that you might have. Okay, so where do we get our authority? Of course, similar to what Dr. House mentioned, we have statutes, and then we have rules that govern the work that we do primarily. So our main statute for the Animal Health Division is the Livestock Health Act, which is Statute 35, Article 50, and that gives statutory authority to the Commissioner of Agriculture, who is my boss, and she delegates that to me as the state veterinarian. And that allows rules, or allows for rules to be adopted for a number of different things: livestock disease, import and CVI requirements, quarantine authority. It also allows for enforcement and civil penalties. And the one rule that probably comes into play more with rabies is our livestock disease control rule. So this sets a lot of different standards, one of which is CVI standards and import rules. And I wanted to mention this specifically. As Dr. House said, there's not a statewide vaccination requirement. However, if you are bringing dogs and cats over the age of 3 months into the state of Colorado, there is a requirement that they be vaccinated. So we don't have any intra-state requirements for vaccination at the state level, but we do have a requirement at the Department of Ag that any dog and cat coming into Colorado over 3 months old must be vaccinated for rabies. PACFA also has some new rules on that side as well. So they also, govern the facilities that they inspect and ensure that they're meeting those requirements, both for CVI and for rabies vaccination requirements. This rule also outlines our reportable diseases, and I'll show you that here in a second, and reporting requirements. So essentially, any person that has knowledge of a reportable disease must report it, whether or not that person is a veterinarian, whether that person is in law enforcement, anybody that has knowledge of a reportable disease must report it. So this is our reportable disease list at the Department of Agriculture. This also is available as a PDF download. You can download it, post it, so you have our contact information. Rabies is one of our reportable diseases. So in Colorado, as Dr. House mentioned, we've got a lot of different folks that do rabies control. So CDPHE and local public health, we like to think of kind of on the companion animal side. CDA, we do livestock and horses and livestock. And so that's, if you guys have questions, anything on livestock and horses, we're the folks to contact. And then we've got our wildlife folks that'll talk after me and explain what their role is. So, like I said, livestock, both for suspect cases and exposure. So if we have livestock that are neurologic, livestock that, you know, are a suspected case that we think could potentially be rabies, that's always reportable to us. And the challenging thing with horses and livestock is there's a lot of different differential diagnoses for neurologic livestock. So for horses, we have a lot of reportable diseases that cause neurologic condition in horses, not only rabies. So rabies is one of them, and that's the one that we're most worried about when we think about human health and the potential for exposure to people and other animals. But there's things like equine herpes virus. There's all kinds of different differentials on the equine side that are high on our list for concern. The other thing on the other livestock side, so ruminant side, is transmissible spongiform encephalopathies is another differential diagnosis. Depending on the species, of course, is, you know, something that we need to know if it's a neurologic case, so we can be sure we test and rule out rabies or TSEs or any of the other number of reportable diseases. So livestock exposure is when we have wildlife or another domestic animal that is rabid that has exposed wildlife, that has exposed livestock. And that's when we would deploy one of our field veterinarians out for a field investigation. And Dr. Ken Newens is going to give you all of the run through of how we do our field investigations here in Colorado and what their role is as field veterinarians and how they determine livestock exposure. And from that field investigation, then we take that and we'll set what our quarantine and what our vaccination requirements would be. We do have a rabies algorithm that we developed several years ago that we use kind of as a tool when we're doing these field investigations. But Dr. Newens will walk through that, and, you know, not one case is the same. So everything, you know, really has a fresh set of eyes and looks through with, you know, risk for exposure. We also, I think it's really important you guys know, we always coordinate with CDPHE at the state level, of course, and local public health, as well as the number of other different agencies and entities that are on here, depending on who has been involved in those cases. So, you know, we are constantly in communication with Dr. House and Dr. Marzak with CDPHE. So we're all on the same page when it comes to these cases that do have a lot of different facets. So in Colorado, we have had a number of livestock cases over the last several years. And starting in 2018, we had an alpaca. In 2019, we had a llama and a steer. In 2020, a sheep, one bull, and one goat. And last year, in 2021, we had a mule in January, and then a miniature horse. And you'll hear about some of these cases as well during the case presentations tomorrow. So when it comes to, like I said, all neurologic cases in livestock and horses, we always ask two questions. And the first question, as well as most other cases, this is not just livestock, but for other species as well. The first question we ask is the animal vaccinated for rabies? Because that changes or might change where we put rabies on our differential list. And then the second question, is there exposure history? and then what qualifies or what classifies exposure history. And then I'm just going to leave you with one really brief video. This is not from Colorado, and there's no sound on this video. This is a video, I believe, that came from Florida. I got it from some colleagues actually in Kansas. But this is something that we would look at and try to classify exposure. This was an owner had noticed a fox following their horse out in the pasture, and the video is not too long, but as the rabies virus does, and there the fox, it's a little bit grainy, but you can see that the fox bit the horse right on that back leg. So definitely something that qualifies as exposure. They did test that, and it was positive for rabies. So that is something that, we take into consideration when we're thinking about potential rabies exposure, potential rabies risk. Do we have a known wildlife domestic animal interaction? What did that look like? In this case, certainly was. And when you think about in livestock, traveling 50 to 100 millimeters per day, that incubation period is going to be pretty long for a horse that size, getting bit all the way on the fetlock to travel all the way up to the brain. So livestock cases are a little bit different. We usually have a little bit longer quarantine time, but just wanted to leave that as a kind of teaser to talk about case investigations tomorrow with Dr. Newlands. And that is the end of my presentation. Let's see if I can click to my next slide. Here's my contact information. Feel free to send me a message if you have any questions, and there's our office number. As well as if you guys do call our office after hours, we have a veterinarian on call 24 hours a day. So if you call after hours, you'll get the on-call veterinarian cell phone number, and you'll be able to connect with them. So I will turn it over to Dr. Fox with Parks and Wildlife.
Thanks so much, Maggie. I'm Karen Fox. I am one of 4 veterinarians in our wildlife health program at CPW. My specific role is wildlife pathologist, so that means I'm handling all of the wildlife necropsies for the state. But also on this call today, I do have 1 or 2 wildlife officers who are going to help me answer your questions. So I think we will wait until the end, and if there's time, hopefully they'll help me take care of those questions. In talking about how CPW responds to rabies calls, it's important to understand a little bit about how our agency is structured. And that's because the expected response is going to vary depending on where you are. So our agency divides the state into 4 regions and then subdivides those into 18 areas and then again into 135 districts. And at each of those levels, you have a single person who's making decisions that affect that part of the state. And in terms of the county level, the decision makers for a county are usually the district wildlife managers. And usually in any given area, most of the district wildlife managers are going to give you a pretty consistent response or expectation, but between areas, it can be pretty different. Regardless, if you want to know what to expect from CPW for rabies calls, the best thing to do is to contact your local area office and ask to speak to your district wildlife manager for your county. But I can give you some. Yep.
We're still seeing just your first slide in the PowerPoint.
All right, let me try and advance a different way. Did that advance?
No, we're just seeing the PowerPoint screen.
Karen, to fix this problem, what you'll have to do is stop sharing, then go into slideshow view, and then share again.
Okay.
And I can bring it up for you too, Karen, if you want. I'm working on loading it just in case as a backup.
No, I think the issue is that when I go to full screen, I lose my toolbar. to select to share my screen.
Okay. Do you want me to share? I can share from here and you can just tell me next.
No, I guess maybe the next person can go and I can try and figure it out.
You bet.
Okay, I believe that's me again.
Yep.
Hopefully. Sorry, there's a delay on my camera, so I'm coming.
One thing we've learned in the world of Zoom is, and the world of COVID, is to be nimble and flexible and adaptable. So we're just going to change here for a few minutes and then we'll get back on.
Okay, so it's me again, Jennifer, public health vet. So what about after hours and emergencies? So what is an emergency? Well, the reality is if you're concerned that an animal might have rabies and you want guidance, all of our agencies have somebody that's available 24/7. So after hours, weekends, holidays, that's actually, normally the calls are returned within an hour. So what I do ask is if you're going to call us, is that you give us a working phone number and expect a call back within 15 minutes to an hour. We'll go on the specifics of who do you call when, but what we want you to know is if you're in doubt, call somebody. The on-call staff will be able to help you get in touch with the right person. If it's a health department issue and you call the Department of Ag, they'll get a hold of me. If it's a Department of Ag issue, you've got a sick horse and you call me, we'll get a hold of Dr. Baldwin and her staff. And don't necessarily worry about jurisdiction and who to call when, but if you have a question, do call somebody. And at this point, we have another polling question. So Becky, can you do the next poll question? All right, so the question is, do you know who to contact when you have an after-hours suspected rabies encounter? Your choices are, and I think you might be able to choose more than one, so you have no idea. Yes, you know who to call all the time. Yes, but you only know for wildlife. And yes, but you only know for a cat or a dog. And then yes, but only for livestock. People are still answering. I don't want to rush people. We have almost 250 people in the call, and about 100 have answered the question. Okay, and unfortunately, it does look like a fair number of you don't know who to call. So that's why we're doing this workshop. So we're glad you came today. So we'll go ahead and end that poll and go to the next slide. Okay, so if you have a concern about a cat or a dog, we're going to start with you guys, the local animal control situation. Now, here at the health department, we are really concerned about rabies, but local ordinances may have other things they're worried about. And the Department of Agriculture actually has a dangerous dog ordinance. The dangerous dog ordinance is not ours, but so we do ask people who have cat and dog questions, basically to start locally. If the cat or dog has a medical need, you need to seek clinical veterinary assistance. Yes, we're all veterinarians, but we're not practicing veterinarians. So we need a clinician to assess that dog or cat. Are they really a rabies suspect? And often a veterinarian can, look at that. They may be able to quickly rule out other causes for their illness that they're displaying. And if you do need guidance, you can either call your local public health agency or you can call CDPHE. Again, CDPHE does have 24/7 assistance. And while not all the epidemiologists are veterinarians, they do know how to reach myself or Dr. Marzak for questions that come in after hours on weekends. If you have a livestock question, including horses, you need to call the Department of Agriculture to discuss those health concerns. Dr. Baldwin did mention that there are other diseases that she is concerned about in addition to rabies. So it's important to get those specimens early on. It's not something that, we can't, test it for rabies and then come back, a week later and test it for something else. Those specimens may need to be collected as quickly as possible. And if it is a production animal species, a stop movement order may need to occur. If it's a wildlife animal, it may vary. The first thing we want you to do is, look at it, is it a rabies reservoir species or a carnivore, such as a mink? Has there been exposure to a human or a pet, in which case we want you to contact either local public health or CDPHE. And if you've been able to rule out any exposure to a person or a pet, then to call your district wildlife manager, because that may be a situation where, as Dr. Fox mentioned, they may be trying to do, or she may mention that they may be trying to do some surveillance of a particular disease in a particular area. So even if there's not a human or a pet exposure, there may be additional testing that needs to be done for wildlife species. And if it's a non-carnivore with illness, such as a rabbit, we do recommend you contact the district wildlife manager. Again, they may be trying to do surveillance for diseases in their area. And then rabies diagnostics. After Dr. Fox talks about the wildlife component, we are going to have two speakers, one from the CDPHE's Rabies Lab, and then another speaker from the CSU Veterinary Diagnostic Lab to talk about testing animals. We do have testing algorithms. Now we have another polling question. So Becky, can you launch the next poll question? Okay, the next poll question is, did you know that there is rabies testing guidance on the CDPHE website? So when we send you the post-workshop email, there's going to be a link to our rabies testing guidance. We have that publicly available on our website, and we do update that annually. It's 3 pages of very specific information, including links to the testing labs and which species will be fee-for-service or waived fee. And if you're in doubt and you're confused about what's on there, just give us a call. There are some fee waived situations where we don't routinely waive it, but we may because of extenuating circumstances. And then we routinely get the question about decapitation. Our lab in Denver, CDPHE, does not perform decapitation. So all species that come through our lab do need to be decapitated unless they're bats. Please send the entire bat. Everything else needs to be decapitated. And if it is a livestock species, we actually prefer that go to CSU because we do not have the ability to cut open the skull of the livestock animals. They have much thicker bones than other species. So if you have to send it to us, you're going to have to remove the brain from the skull for us because we can't do that at our lab. We also recommend dogs and cats go to the CSU Veterinary Diagnostic Lab. So the polling question, let's see, it looks like most of you did know that we had the guidance on our website, but you haven't used it. So this is your opportunity to go to our website and get a copy of that guidance, and we do update it annually. Okay, and then a little bit about the cost of rabies testing. I mean, the reality is there's no free testing. Somebody has to pay somewhere for the resources that are used. Testing supplies are not free. Reagents are not free. We will waive the fee for those reagents in specific situations, and this is only for CDPHE. We cannot waive fees for CSU testing. We will waive the fee for wild carnivores that are rabies reservoir species, or bats with human, pet, or livestock exposures. And then in areas where the skunk variant has not been identified, Dr. Marzak did show the slide. If you just think, mountains west are skunk variant free. In the event that there's a symptomatic rabies reservoir species, such as a skunk, in a community there, even if in the absence of an exposure, we would probably waive the fee for surveillance purposes because we want to know if skunk variant is moving. Everything else is essentially a fee for service to pay for those reagents and testing supplies. Dogs, cats, and pet ferrets, by statute, that Colorado revised statute, it's mandatory for those animals to have a 10-day bite hold. There's actually not a clause in statute that says you can test them instead of quarantining them. So they are required to have a 10-day bite hold. Now, we don't want animals to suffer unnecessarily. So if you have a dog or a cat that was hit by a car and it's terminally ill, or it's a feral animal that's never been in a cage before, those are situations where we can waive that 10-day bite hold and actually test the animal. But the reality is we don't want to test dogs, cats, and ferrets. We want these animals to have a 10-day bite hold, and if they're family pets, we want them to go back to the family after that 10-day bite hold unless they become symptomatic for rabies, in which case we can do a test, but that should never be the default for a dog or a cat that bites. Other things we're going to charge a fee for are secondary exposures, such as a cat caught a bat and the owner wants the cat tested. Well, it's a terminal test, so we don't want to test the cat. We want to test the bat itself. Or in occupational injuries, we have had situations where the exact same clinic was sending us a dog or a cat that needed to be tested on a near weekly basis because it bit one of their technicians. Once we started charging a fee for that, it was amazing how quickly they got control of their bite situation at the clinic. So we will charge for workman's comp issues. And if there's no public health concern, particularly like for things like a diagnostic, if you have an animal that hasn't exposed anybody but you think it might have rabies, if you're not on the western slope, then we're probably going to charge for that. The current fee is $65 at CDPHE for the rabies test only. We have not changed that fee in many, many years. I hope we don't have to change that fee, but supplies are getting hard to acquire and they're going up in cost. So at some point that could be reevaluated. If it is, it will be on that testing guidance that's on our website. And the Veterinary Diagnostic Lab also has a fee structure that's based on the service. They have a rabies test fee, which is very similar to our test fee. And if they need to remove a brain, they can charge a fee for that. If you need a decapitation, they can do that there in their on their necropsy floor. So if you can't do a decap, that's okay. Just send it to CSU. And we also recommend you use CSU if you have other testing that needs to be done, such as if it's a sheep that needs scrapie testing, if it's a dog that needs distemper testing. We recommend that you utilize the Veterinary Diagnostic Lab for rabies testing. So at this time, I am going to hand the presentation back over to Dr. Fox so that she can finish up with the Department of Wildlife.
All right, let's try this again. So is that advancing now?
Looks good. We can see,
Okay.
yep, first
Great.
slide and second slide, yep.
Okay, so this is where I left off. So I can give you some general expectations of what to expect from CPW for rabies calls, even though it is going to vary a little bit across the state. So by Colorado statute, CPW does have the power to provide for the destruction of any wildlife that poses a threat to public health, safety, or welfare. And what that translates to in terms of CPW responsibility, we do have an internal administrative directive that mandates that all predator human attacks will have an investigation conducted by Colorado wildlife officers. So what that means for you is that you should always contact CPW about a predator attack on a human. We will respond. We need to respond and conduct an investigation. In terms of damages from wildlife, this comes up sometimes if there's a wildlife attack on livestock. Authority for depredating animals lives with the Agriculture Commissioner. However, CPW does have responsibility for liabilities from damages from wildlife and compensation. And so what that means is if you have a situation where there are damages from wildlife, landowners can contact CPW for assistance investigating liability and compensation. There is this gray area when it comes to nuisance wildlife, so I wanted to talk a little bit in depth about this. There's also a fact sheet that we have on nuisance wildlife laws that will be provided after the workshop that you can pass out to people who ask you questions about, or you can refer to yourself. But basically, CPW does not require nor request the removal of wildlife deemed a nuisance. So instead, CPW gives a landowner the authority to determine when an animal has become a nuisance. And if determined a nuisance, we give them the authority to hunt, trap, or take that nuisance species. And generally, this applies to species that are coyote-sized or smaller. And if the species is not specifically covered by the fact sheet, you should assume it's illegal to hunt, trap, or take them without a license. There is guidance in that fact sheet on methods that are legal for take, but that fact sheet defers to local laws. So what to take from this is that CPW might not respond to calls involving nuisance wildlife. And that's because authority is given to the landowner to deal with these species. And our response to these types of calls is going to vary quite a bit across the state. If you want to know what expectation to have, the best thing to do is to ask your district wildlife manager. CPW also has authority over wildlife possession. Colorado law generally prohibits the live possession of native and exotic wildlife. So if you have a case where you suspect that someone has illegal possession of wildlife, we definitely want to be contacted about that. So I've mostly addressed our wildlife management side and how they respond to calls. I'm actually in a different branch from our wildlife managers. I'm in our wildlife health program, and my role is different from our wildlife managers, but our programs do overlap, especially when it comes to things like mortality investigations. Because I'm in the wildlife health program, my priority is wildlife health, but the wildlife managers might have other priorities that take precedence over wildlife health. What we like to see happen is that the wildlife manager decide what they want to be investigated in their districts, and then the wildlife health program prefers when those cases get submitted through a wildlife manager. So hopefully most of your contact is going to be with your district wildlife manager. However, I will say that if your local wildlife managers are not able to respond to a call and you think that this is a wildlife health problem that you think I'd like to look into, you are welcome to contact me directly. You've got my email listed there. It will also be provided later. And I might be able to help you work up a case if it meets my criteria for investigation. Things we might want to look at that I haven't already covered. If there's a deer or elk or moose attack that doesn't necessarily fall under the predator attack that I mentioned earlier, but it's certainly unusual. And in most cases, CPW is going to respond to that if you contact them. If there's any animal that's been in the media, that's something that we'd like to respond to so that we can address the questions that we know will be coming our way next. Any other bizarre circumstances, anything that might have legal implications would be other reasons to contact CPW. It's always okay to ask, even if someone says, no, we can't respond to that. Most people are going to be fine to answer your questions. Most of what you might contact me about directly to say, hey, do you want to work this up from a wildlife health concern standpoint, is passive disease surveillance. So this is the kind of surveillance we do where we're just kind of keeping our finger on the pulse of what's going on with Colorado wildlife. So if you have a die-off where there are 3 or more animals found dead in a small area within a 2-week period, that meets our threshold for investigation to see what's going on. Occasionally we'll look at an individual animal, usually not if it's a single animal found dead. That doesn't kind of raise our level of concern. But if it's a single animal that's seen alive showing clinical signs, that might be something that we would follow up on. The exception to this sort of 3 or more or individual showing clinical signs, we might not investigate for a known endemic disease like rabies or distemper if we already know that that disease has been present in that species in that county during that season. We just don't have the resources to test every skunk with rabies in a given county and season. And we did put together this decision tree that helps us decide when we're going to test an animal, a wildlife species, for rabies. And you'll notice at the top there, every decision tree starts with the question, was there contact with humans or domestic animals? If so, we always defer those to public health to work up from a public health standpoint. If not, the decision tree kind of walks you through the species, county, and season questions to determine whether that's something that we want to test for. And this will also be shared after the workshop. So in general, from the standpoint of the wildlife health program, we see that there are a few objectives that we are trying to achieve by doing rabies virus surveillance. We want to just monitor the occurrence. We want to try and prevent transmission. We want to detect other diseases that may mimic rabies. We want to look for spillover of bat and skunk rabies into other species. We want to detect the emergence of strains other than bat or skunk rabies. We want to do this in a way that minimizes exposure to rabies suspect carcasses. And when we do have an exposure, we want to work with CVPHE to make sure those exposures are investigated from a human health standpoint. And ultimately, we want to do these things using CPW resources efficiently. And that, again, is where it comes in that your district wildlife manager is going to decide whether that case merits them helping with the euthanasia or the decapitation or getting the carcass to me. And I work with them to help make those decisions as well, but ultimately that is their decision. So in summary, for expectations for CPW, if there is a human or domestic animal contact, we always defer to public health. If it's a rabies or distemper suspect with no human or domestic animal contact, we use that decision tree to determine whether we want to test for it. And if you want to contact me directly about cases because you've not gotten a response from a district wildlife manager, I'm happy to work through that decision tree with you as well. If you have a human attack by a predator, you always contact CPW. If there's damage to property, you can contact CPW that can help determine liability and compensation. If you have anything strange or unusual, don't hesitate to contact us and let us know. In most cases, we'll probably take a look at those. Know that CPW might not respond to calls regarding nuisance wildlife. And always know that it's your district wildlife manager who's going to be your best contact to discuss expectations. So I'm going to stop sharing. And I don't know if we have time for questions. I do have some wildlife officers on who might be able to help.
I think we do have a little bit of time for questions, and we do have one in here, Karen. So the question is in the chat box. It says, for clarification, if a fox is living under a home and is acting strange, is the homeowner responsible to destroy and test? Let's say it hasn't bit a pet or person yet.
So if there is a fox and it's acting strange, that falls under the single animal seen alive with clinical signs where it might have rabies or distemper, something that would want to work up. And so depending on your district wildlife officer, they may not respond to that if they are considering that fox as a nuisance animal. And I'll maybe let Justin let me know how he would handle that. But I would still want to know about it if it was showing clinical signs, so we could potentially work it up from a wildlife health standpoint. So there's really two different interests at work there.
Yeah, Karen, can you hear me okay?
Yes.
Okay. I just from my perspective as the officer in the field, I guess would have to have the backstory on that as to what would be considered acting strange, because that could be a habituated animal that's being fed too. There could be a background as to why that animal is doing what it's doing. And so I think it definitely borders on the, testing threshold of what we would need. And obviously if it hadn't bit a pet or a person yet, then I would say from our perspective in the field, that would be something that would fall under those nuisance guidelines that you mentioned. From our standpoint, again, just reemphasizing from the field though, like you said in your talk, that contacting your local respective CPW office for chatting with your local officer is going to be a great recommendation for anybody in that as well. And one other point, just while I'm here, I did respond quickly to a question in there as well. You hit it on your thing about wild animal attacks not involving a predator, and anything involving other animals, deer, elk, and moose, like you said, but also anything involving a small game animal. I mean, if there's a coyote that attacks somebody or something, any human safety threat, obviously those need to be reported to us since we're the primary one to start that investigation in the field.
Thanks so much, Justin. All right, so I guess we'll get us back on track with the schedule. Sorry for that interruption. Thanks for your patience.
No worries. I think we are headed over to our lab folks next. Brandy, I think you're up first.
Yeah, I don't have the ability to share.
Oh, okay. We don't have you as a co-host.
No.
Becky, could you add Brandy quick as a co-host so she can share her screen? Otherwise, I can share your presentation as well. Maybe while we wait for that, Karen, it looks like there's a new question in the Q&A, and it asks, is there somewhere we can track data for seasonal testing in our county?
That is a great question. We have talked about having a centralized repository for that information. If that's something that people have an interest in, I can work on getting that set up. So if anyone wants to email me and say, yes, this is something I'd like to have access to, that'll help me gauge the level of interest.
All right. Can everybody see my screen?
We can.
Perfect. Okay, my name is Brandy Stidley. I work at the State Public Health Laboratory. Specifically, I am the serology unit work lead. Starting with, hang on, there we go. Starting with, what do we do at the State Public Health Laboratory? We're actually like a very wide-ranging laboratory. We, at our building, we cover everything from clinical testing. This could be anything like COVID or whole genome sequencing. We do newborn screening there. We have emergency response. This would include, we're part of the laboratory response network, which means that we test for select agents. We have surveillance testing, food testing, water testing, the list goes on and on. We have tons of stuff. We also have a website if you're ever interested in seeing what we do. But the big thing that we're going to talk about today is our rabies testing. So rabies testing at the state laboratory is primarily done by two main staff, which is myself and then also Wendy Child. So you might talk to one of or the other of us on the phone or through email if you ever contact us. And I really wanted to shout out how much rabies support staff we have right now. In the past, we've had very few people who are actually vaccinated and trained to do rabies testing, and our facility is trying to train more people as backup staff so that Wendy and I can actually, like go on vacation or be sick. So we have a lot of support staff, way more than we ever have. Crystal Monaco, Joyce Knutson, Kristen Mayo, Leah Ricci, and Kim Hun Templeman. So we're very excited, and we're actually training a couple more people. In 2021 at our laboratory, we tested 982 specimens total, and we had 77 positives in the past year. So what does our testing pathway look like? So if you sent us ahead, we would get the sample and unpack it and accession it ourselves. So that has to be either Wendy or I accessioning that sample. And if there's a question real quick. Did you say that your lab staff is rabies vaccinated? Yes. So only the people who are trained to handle rabies are rabies vaccinated, because it is costs a lot of money to get people vaccinated for rabies. So we try to keep it down to just the people who are going to be actually physically working with the samples. So we have an accessioning unit for our laboratory, and they don't unpack any of our samples just because they're not rabies vaccinated. And we just want to keep that little bit of safety there so that they're not endangering themselves by opening a box for us. So Wendy and I are generally the ones, we get the samples and we log them into our online system. We then are going to go into BSL-3. So we do a little bit of preparation. We gown up, which means that we are wearing a waterproof disposable gown. We're wearing shoe covers. We're wearing an N95 or some other sort of respirator. We also have some air purifying respirators that we use. And then we're also wearing eye protection, and we're double gloving. So we're always making sure that we're really careful in there, since we will be handling, like Natalie said, the brain tissue, which is the part that we're really concerned about could have rabies virus still present. So then we're taking these samples into the BSL-3 lab for necropsy. The way that we're testing is through a DFA test, which means that we are actually putting an anti-rabies conjugate onto a tissue impression on a slide. So those tissue impressions are made from cerebellum and brainstem. So one thing you might see if you ever end up with an unsat sample from us, we might say that it was decomposed, and that's just usually means that we couldn't tell, the brain tissue had broken down so much we couldn't tell the difference in the tissue types. And it's really important that we're testing both tissue types. There's CDC guidelines for this. It's called the Rabies National Standard, and that's what we follow in our testing. So we'll take a tissue impression on a slide. Those samples are going to be fixed in acetone, and those sit in the freezer for at least an hour before we're able to stain them. Each rabies sample is actually, when we work with it in a biosafety cabinet. So between every rabies sample, we have to fully move everything out, clean it, and then go on to the next sample. I just wanted to illustrate how long rabies testing can actually take. So samples can take between 10 and 45 minutes, which is quite a bit of time. And especially in the high sample season, which is our summers, somebody can end up spending a couple of hours in there just doing the necropsy portion of this testing. Samples are then taken out of the acetone and stained with our anti-rabies conjugate. And then on top of that, per the CDC guidelines on this, 2 technicians are required to read our slides to make a definitive call. This is because we want to be absolutely sure that when we look at those slides, we are looking at every single portion of the slide, and that 2 different technicians are actually seeing either positive viral inclusions or not. And so I have some pictures on the slide. These are from the Diagnosis of Rabies, the national standard from CDC. And you can see that bright apple green color, that represents viral inclusions in the tissue. So that's kind of what we would see on our slides. Once we've done this, looked at the slides on our microscope, then we are entering our results. We're notifying Epi of any positives or anything strange, and reports are going to go out. So Dr. House actually covered a lot of this, so I'm going to be brief. We do wildlife testing. It is, for carnivorous mammals and bats, it is typically fee waived. If there are any domestic animal testing, like cats and dogs, ferrets, things like that, we would only usually indicate testing in case of an exposure. And like Dr. House said, there is that 10-day bite hold. So just be aware of that. If you typically, these tests are fee for service though, so we would charge that $65 fee to test these animals. Again, if you have any questions, like she talked about, the CDPHE rabies submission policy is online. It is super helpful. It has all the information you could need. It has phone numbers that you can contact people. So I would highly, highly recommend looking at that. And it is, as Dr. House said, constantly updated, at least yearly. Okay, so ordering a rabies test. At the CDPHE laboratory, all of our rabies testing requests are online now. So if you haven't submitted one in a while, or you've never submitted to us before, just know that we have a system called Lab Online. All of our test requests will go through there. You can order a test through that system. It'll allow you to order the test. You'll be able to track your sample progression. It'll kind of tell you once we receive the sample that we're in process of working on it, and then you'll know immediately when the result is reported. This is really helpful because you don't have to keep track of like paper fax reports anymore or anything like that. Or like if you lose a report in your email, you can always go to the website and find your report again. So it's really, really helpful. So if I have some, just kind of some links on here that are helpful. There's a user guide that can walk you through it. Obviously, if the user guide isn't working for you, you can always call us. I'm happy to sit on the phone with you and just kind of walk you through the steps of ordering a rabies test. I want to emphasize, though, that every sample that you are submitting needs its own chain of custody, which means you have to request a test individually for each sample. So if there's a case where you found 3 bats in somebody's home and they all need to be tested, I need you to submit 3 test requests. And that gets a little confusing. Each of those samples should be in their own bag. And then we always need you to identify those samples with the chain of custody number, which is circled there in red. That's kind of what it would look like on the form that you would get from Lab Online. So once you've requested a test, the Lab Online will create a PDF document. That PDF document will have your chain of custody number on it and a barcode. And you can print that and put it with your sample, or you can always put that chain of custody number. Just be sure you are writing it correctly. We've definitely had some mix-ups on numbers before, but as long as you are clearly writing it and correctly noting it on the sample, you can just write it on the sample bag. You are welcome to do that. So what makes a specimen ideal for rabies submission? The specimen should be decapitated for us. Our lab does not perform decapitations. We don't really have the space or the technician capacity to do that. Bats should be euthanized and submitted whole. Be really careful when you're considering a bat euthanized or not. We have sometimes gotten bats that are actually still alive. And we know how to handle that, but just be careful when your staff is doing it. Sometimes when you think a bat is fully euthanized and it gets put in the fridge, it actually just kind of goes to sleep, basically, and it wakes back up once it's brought to room temperature, which is what happens when we're testing it. So just be aware that that can happen. We need the brain tissue with all the structures intact, and you can actually, as Dr. House said, you can submit that brain tissue to us directly. So if it is a large animal, we can do that. But if you can't actually remove those brain tissue with all the structures, we would recommend you send to CSU instead for those larger animals like livestock and things like that. We want the specimen to be fresh. We want it to be kept refrigerated until you submit it. Freezing is okay, but that does require extra testing time. We usually only recommend freezing when there's sort of something weird going on, or it's a long holiday weekend and you won't be able to get it to us until Tuesday or something like that. But just know that we have to fully defrost that specimen basically before we can test it. So it does take a little bit of extra time. And we would love our specimens to not be decayed or desiccated. If there are maggots on your specimen, if it's roadkill, we don't want that. We don't want any brown or green oozing liquid. Usually it's a bad sign if your specimen is extremely putrid smelling or rotten smelling, and then not skeletal or mummified. So that usually happens with bats. People will find them in closets and they're basically mummified in there. And of course, you may not know that. You're welcome to submit it. We'll let you know if we figure that out inside the lab. Okay, so for decapitation, we refer to a really good decap, something that makes it really easy for us to do our testing when the decap is done at the back of the occipital bone and it severs the ligaments at the atlas and the occipital juncture. So when we get a head like that, it's been really nice. It's actually really easy for us to get the structures that we need out of that animal. So we do recommend to try and do that. I have this really interesting drawing that somebody made for the New Mexico Public Health Department. I kind of like it just because it shows this is a good way to do this because you don't have to use as much force. You don't have to use any bone saws or anything like that. And it just sort of shows how you can hang the dog head off at the table and basically use that angle to get at the occipital juncture. And with that method, you should be able to do that mostly with a scalpel, which is pretty nice. If you prefer to use a bone saw, a hacksaw, anything like that, that's fine. We would prefer that you aim to go through the atlas, which is that top vertebrae that the occipital bone sits on. That just makes it a lot easier for us to handle inside of that hood that we're working in, and is a little bit quicker for us to be able to process. When you are doing a decap, don't forget your PPE. Please wear PPE. Please be safe. While you're doing this, we recommend disposable waterproof gloves, waterproof coveralls or apron, disposable face mask, and safety glasses or goggles. We also recommend that you let the head drain, as kind of icky as that might sound. It's really tough to get a bagged specimen where the bag is just also kind of full of blood because it hasn't been drained. So we would love it if you could actually drain those specimens even briefly before you bag them to send to us. And then of course, please disinfect all your surfaces and reusable equipment appropriately. We at the lab, we use 10% bleach followed by ethanol. Just make sure that you're really cleaning up afterwards. Rabies is no joke, so, you know. Okay, packing a specimen for submission. Keep the specimen cold during the shipment, use ice packs. Please do not use wet ice or dry ice. Specimens must be double bagged. This is probably the biggest thing that we run into as an issue over the summer when things start getting busy. And I don't know if it's just people probably forget or somebody wasn't trained appropriately. They should be double bagged. This is for our safety. This is for the courier's safety or whoever's transporting it. And then we also recommend that it's placed in a solid tertiary container. So your primary container is a bag, your secondary is a bag, and your tertiary should be something solid, whether that's a cardboard box or something like a cooler. Again, ice packs would be nice, but I know that some of you are actually delivering from someplace pretty local to us, and so you're just driving it over straight from the fridge. That's fine, but throw it in a box. It just really helps keep our staff safe, especially the people who are accepting that sample at that receiving door. And again, it keeps everyone safe in between. So all of your outer containers should be labeled with a category B substance sticker. That's the UN 3373. This is the same for FedEx or courier. So if you don't have some of those stickers, you can actually print these. So we can actually get you, we have basically a page that's just a bunch of them over and over again. You can print them and tape them on. We're happy to provide that to you. But that actually is a requirement by IATA to transport specimens. My last note here is don't put your chain of custody form inside of the bag. We can't actually open our bags until we get into the biosafety level 3 laboratory, which means that we can't access that chain of custody or that number or any of that information until we get inside. And that just makes our job a lot harder. So if you could please put those chain of custody forms, you can tape them to the outside of the bag, or like I said, you can write that sample number on the bag. It's really, really helpful to us. All right, so if you're shipping to us, our address is here. You can always drop a specimen off in person. You can send someone over from your organization to just drop off. We have several people who drop off to us who use like reusable coolers, and we will actually return their coolers to them. So they kind of have a rotation of several coolers they're using. Specimens can be dropped off between 7 a.m. and 5 p.m. Monday through Friday. Be aware that our accessioning unit, because of COVID, is open on the weekends. You can drop a sample off, but it will not get tested until Monday. So your sample is going to just sit there. So just be aware of that. Our laboratory does provide a free courier service for the Front Range. I have a link here. It'll take you to a website that is all the courier information and a courier request form. It's a Google form you can fill out. I just want everyone to be aware that couriers run on a set schedule. So like that's what the state pays for, is these couriers to be on a set schedule to go to different local public healths and to different areas. So please stick with that schedule. So every time we have an unscheduled pickup or anything like that, it ends up in a really large fee for us. And we can't keep providing courier service if we have to keep paying all these extra fees. So try to stick with the schedule. If you think it is absolutely an emergency, you really need to get it to us, you are always welcome to call us, or you can call the Eppies at the phone number that Dr. House gave you. They will walk you through how to get it to us even quicker. You can also use FedEx to ship if you're on the Western Slope. If it's really hard to get your sample to us, we just want to make sure that you are following all IATA regulations. If you don't follow these regulations and you are caught, you can have huge fines for your facility. So just be aware, you should be following all regulations. You can always call the lab and ask us how to pack something. We're happy to walk you through that. And make sure that your package is shipped overnight and not standard. And that's all I've got. You are always welcome to call us at the lab. That's our phone number. The serology unit is myself, Wendy Child, and Ashley Alawi. Any of us will take your emails and answer your questions. And that's our website. We have tons of information on there for you guys. Thank you.
Awesome. Thank you so much, Brandy. We've got our last presentation, and I know we've got to wrap up in the next 10 minutes or so here. So Dr. Christy Mayo, who is labeled as Callie Lang, but is not in fact Callie Lang. Dr. Christy Mayo is from CSU, is going to present. So while she's working on sharing her slides, I just wanted to do a couple housekeeping things real quick. So Becky Hoffman is going to drop a couple of links for, well, one link for you in the chat box. And that is going to be, if you want a certificate of attendance, click that link, fill out the form. It has to be one per person. So if you've got multiple people that are sitting in a room, you'll have to do a couple. Fill out that form and you will get the certificate of attendance that you may or may not be able to use for CE or whatever else you would like to use that for. And last, in the last couple minutes, Becky will launch the last poll here in just a minute or so. We'd just like feedback on, whether this workshop was helpful and useful for you. And we look forward to day 2. So I'm going to turn it over to Dr. Mayo.
Thank you, Maggie. And yeah, this will just be a nice introduction for those of you who may not know me. The people that do all the work behind the scenes will just glorify those folks at the end, but I'm just here to do a highlight reel of the CSU Veterinary Diagnostic Lab and what we have to offer for rabies testing and other testing. So just to highlight here, we have 2 labs that do the rabies testing, one here based in Fort Collins, and then the other one is on the western slope for those needs. And so everyone's really spoken to this, and especially the last presenter, about workflow and how things arrive to the lab. And then there's always this, how long does it take to get results? And so I would like to say on our website, it's 48 hours is what we quote, and you'll see down here at the bottom, that's with ideal conditions though. So when we have ideal conditions, samples coming in, we've heard all about, you know, the proper way to submit, that can be a couple days. However, you see all these little red ticks right here coming up that sometimes we have frozen tissue. So if it arrives frozen, then we got to wait for it to thaw. That can delay 4 to 6 hours. You know, if paperwork communication's not there, that can be another couple of hours. The actual testing does take quite a period of time, and we've just highlighted that. So just knowing that's a lot of time just there. But from the workflow that you see here, we consider it a biosafety hazard once it arrives. If you've indicated anything's rabies testing, we take it very seriously, run it through our virus section, and then ultimately we're reporting results and communicating with all the agencies that are talking today. And I'm just so lucky to be part of it. So if anything's positive, usually if it's had maybe more of a domestic animal situation or human exposure, just wanted to let y'all know we do send that for typing out the CDC. And so I won't go over this. We all know this is a big biohazard. Often we're thinking of species in our repertoire of, you know, the raccoons, skunks, and bats. But this is how we display it at our lab. Just several indications of different, I guess also highlighting rabies is not the only one. So we have a lot of different biosafety hazards and always using universal precautions to be considerate of that. And so we already talked about all the reservoirs today, the skunk, raccoon, fox that we see, bat being ubiquitous. But one fact that I found interesting was this approximately 59,000 deaths are attributed to rabies annually worldwide. And so I think in the Americas, at least in North America, we have it pretty good in terms of we have good vaccine strategies and good testing protocols that help us try to prevent that. But as we're thinking about not only those reservoirs, we're also thinking about domestic species, especially in the veterinary community, and things that are submitted to us. And so I'll just keep it short and sweet because we've already been through this, but we're definitely looking for usually cerebellum and brainstem. So sometimes that comes in the form of decapitation, but sometimes we get whole bodies as well. So that is one highlight I think that's been really referenced here, is that CSU has a whole necropsy floor full of pathologists and residents that can actually do the decapitation and brain removal for us. And so we're going to do the DFA, usually the direct fluorescent antibody that just was spoken about. If positive, it lights up in green. And we do proficiency test on this. So we make sure that we call it a PT, and we make sure that we're calling things right when they're right, and calling them wrong when they're wrong, and we make sure we pass that. And so just down to the nitty gritty, what do you need to know? Like I said, 48 hours is the turnaround time. Cost is about $65, but there are some add-on fees that I think sometimes gets confusing for folks. So just talking about those brain removal fees, they don't come cheap. But for small animal, it'll be about $25 on top of the rabies testing alone for $65. And then for a larger animal, $50. So just being aware is these normal practices. This would be during a normal business hour type of day. That's what we can have a level of expectation. And this is a busy slide, but main take-home points are we don't have any testing on Sundays. So if you're going to call us after hours and we're going to come in, we're going to have some new criteria that might be new to some of you. So what does that look like? Highlighting. We need someone to be there on the other end receiving the results. We have a lot of people submit, and then we call for open space. So one criteria is going to be that. The other criteria is a stat fee. So on top of all the other fees, there will be a $250 stat fee for us to be coming in. And this is just to be aware of some of the changes we've had going on. Again, we want, I think a lot that's been highlighted here, exposure to wildlife and unvaccinated, completely unvaccinated animals are the main priority for us to come in for after hours testing. And then we have the small animal kind of companion animal situation, and then we move over to large. And so in this situation, if there was human exposure and potential exposure to saliva of an unvaccinated animal, we might come in, but there's always a discussion going on between us, the client, and the pathologist in terms of the virology space. And then just with large animals, we all know we may also come in if it's going to affect a downstream diagnostic, such as a necropsy result or something that's going to affect you and a veterinarian's decision making. So we will, at our discretion, we have a good, robust conversation with the pathologist to see if that's warranted for us to come in. And last but not least, there are some rare occasions that we're having discussions to also come in. So just be aware, there are conversations going on, but we're trying to limit most of our after hours and weekend testing unless it's really critical. And so we're kind of getting to the ending of my presentation, but one thing I do want to highlight as a veterinary diagnostic lab is we have a whole suite of folks that are doing amazing testing every day. We have veterinarians that can try to interpret maybe differentials in diagnostics, but we've been talking a lot about when things come up positive, that's great, and that would be indicated here. But what happens when things come up negative? This is just an example of all the differentials that can be considered for equine neurological disease. And Dr. House highlighted that there are suites of other infectious diseases, but we don't want to delay our samples to continue testing. So one advantage here for like equine cases or for bovine cases is that we could totally be able to do the TSE testing really quickly, get a sample routed, or any other testing if you want to reroute the conversation or people that are submitting animals. So we're always open for that. And last but not least, I need to acknowledge all the CSU heroes, the virology folks that do a great job every day, just getting in here and doing amazing diagnostics, especially for rabies. But the champions that also have to commit to this, from our necropsy to sample receiving in office. And so that, I'm going to wrap it up. Questions for all of us, and thank you.
Dr. Mayo, thank you so much for zooming through those. Sorry that our time got cut short. There was one question at the end that asked if you send samples for variant typing to CDC after they're positive at CSU, and the answer is yes.
Yes, we do, and we try to stay in communication with the client that's submitting, of course, and public health, and Natalie Marzek from everyone. In fact, the other week when I joined, it's just nice to see everyone, and we're always in communication.
Yeah, absolutely. Well, that brings us to the top of the hour, and that was a jam-packed 2 hours with a lot of good questions and discussion. Really looking forward to day 2. I hope everybody's able to make it. If you're not, again, we will be recording these and making the recordings available for those that were unable to attend both parts of the workshop. I think you guys all have our contact information, so feel free to reach out if anything comes up. If you have questions that you think of in between now and then, you can still use that question form that we sent out and ask those questions in there, and we'll try to get those addressed at the end of the day 2 presentation. We're hoping we'll have a little bit more time for discussion. So again, thank you for all the work that you guys do to protect public and animal health in the state of Colorado, and really appreciate your attendance today.
Maggie, it looks like we have a couple of raised hands that just came up.
I'm available to stay on a little bit if there's folks that still have questions that wanted to ask. Otherwise, feel free to drop those in that form link that we had sent out. If there is anybody that wanted to ask a question verbally, we can hang out for a minute or two. Did you show the link for the CE form? Yes, it's dropped in the chat. Becky, do you want to drop that again? And what we're providing is certificate of attendance. So if that's something you guys can use for CE, please feel free to do that. There, Becky just dropped that again. It looks like we've got a lot of folks that have already filled that out. So please feel free. We'll hang out and leave the meeting open so you guys can grab that link.
So this is Joanne Bowen, and I'm not finding the chat area to find the form.
Yeah, Joanne, in the bottom of the right-hand screen, there's a little, it looks like a chat bubble next to the people bubble.
Okay, so it's the one with lines?
Yep.
Okay, there it is.
Yep,
And then
and then
where
you
the form is?
Yep.
Well, when
It
I
says-
click on that, nothing comes up.
Oh, shucks. I can send it. We'll send it to you directly, Dr. Bowen,
Yeah.
via email.
Yeah, I'd like to get a copy. Thank you.
Bet. Yep, no problem.
I enjoyed your program, although I did notice that Christy Mayo was identified as Callie Lang.
Yes.
Okay. I thought maybe, I've known Christy for decades, and I thought maybe she changed her name.
No, she didn't. It's a glitch on her computer.
Thank you very much.
Yep. Becky, I think we'll just leave it open for another couple minutes and then we can close out. Just so folks have just enough time to get that link and everything.
Yeah, no problem.
We did have several raised hands during the presentation. I'm not sure how we want to deal with that on Thursday.
Yeah, I think Thursday we'll hopefully have a little bit more flexibility to have, open questions in between presentations. Today was pretty jam-packed on the agenda.
It was, and I also think it might be better if we maybe kind of assign one specific question area to a person. Like Dave was handling the chat, and Dave was handling the chats, and I was, looking at the poll questions. And I think it might be better just because there's all these variety of places they can ask questions. Or we turn off the Q&A so we only have raised hands or the chat.
Yeah. Great.
The problem is that chat doesn't get saved. So
Yeah.
it's nice
It will
to have
email it to me when it's all done. It'll email the whole thing to me when it's all done. So
Good.
we'll have that documented in the folder for the presentation.
Great. So for anybody that's still hanging on, feel free to grab that form and fill that out to get a certificate of attendance. We're going to close in just a couple minutes here, and then we'll be back on day 2.
Is that a new question in the Q&A?
Yeah, I think it's for us to address on Thursday, though.
Oh, on Thursday. Okay.
Yeah, we'll cover animal bites or Natalie will cover animal bites on Thursday.
So it looks like everyone's going to get maybe 2, possibly 3 copies of the certificate of attendance based on
Okay.
the data that's popping up. So I'm not sure why that happened, but I'll try to get it fixed for Thursday. So if people are like, I got 3 certificates, apparently something I set up wasn't 100% correct. So
Okay.
yeah, so just tell them delete the other 2, I guess.
No worries. They'll just get extra credit. All right. Well, Becky, I think we can probably go ahead and close out. We're just about 10 after. So thanks to everybody else that joined. If you have anything, I think everybody has their contact information, but yep, go ahead.
We have a
Looks like somebody had a hand raised. Was there a question? Or maybe just somebody trying to. Press the right button. Okay. Becky, I think we can go ahead and stop the recording. Thanks everybody so much for everything, and we'll see you all on Thursday.